Situation critical, coronavirus out of control. That is the Mayor of London's assessment as he declared a major incident in the capital. The reason? A third more people in hospital with COVID than at the pandemic's first peak in April, 800 new patients needing admission every day, the NHS at risk of being overwhelmed.
I'm concerned that the virus is out of control, but also that the NHS is at risk over the course of the next few days, couple of weeks, to run out of beds unless we see a reduction in the virus and a reduction in people being hospitalised.
London's ambulance service is now so stretched, 75 police officers have been drafted in to drive their vehicles, joining hundreds of firefighters who've already been deployed to help out.
The best way would be a paramedic and another trained member of staff, of course it would. But when you've got as much sickness as we've got and the call rate that we've got, then you need to get someone there that hopefully can give you a hand.
The problem begins when a hospital becomes too busy to quickly admit new patients. And so instead of being back out on the road in perhaps 20 to 25 minutes, crews spend hours stuck outside continuing to treat their patient in the back of the ambulance. And that means the next time an urgent 999 call comes in, there may simply be no one available to respond. As the queues outside two Essex hospitals yesterday demonstrate, this is not just London's problem. Nationally, the time ambulances are waiting to offload patients into hospital is described as off the scale.
We are listening to our dispatch colleagues who are urgently looking for ambulances to go and attend to patients, and we're all stuck at hospital. And I can't imagine how much stress the control room colleagues are under when they're looking at screens of hundreds of patients who are waiting for ambulances, and they're having to decide who's going to get the next one that becomes available.
Today, a grim record was broken, with 1,325 people recorded as dying within a month of testing positive. And with no sign the national lockdown has begun to push down the numbers being taken to hospital, the next few weeks are looking extremely bleak. Catherine Jones, 5 News.
Let's get to more from our health correspondent, Catherine Jones. Real highs and lows this week, Cathy. The vaccine rolling out, but also the number of deaths going up.
I have to say what I'm most worried about is the inescapable path we seem to be set on. The queues of ambulances we filmed today carry people who were infected around 10 days ago. And so even if no one got COVID today, there were 0 cases, London would still have 800 new patients tomorrow, and the day after that, and so on for another 10 days, a rising number, in fact. It's like a wave coming towards a beach. There's no stopping it. So declaring a major incident can brace people, can focus minds, but it can't stop this inevitable. And actually, there weren't 0 cases today. There were 68,000 that we know about. Those are just the tested ones. And worst of all, deaths recorded in a single day surpassed 1,300. It is really all in our hands to stop that new record being repeatedly broken.
Cathy, thanks.